Well, good evening and welcome to another edition of Talking About here on QPTV. I'm your host, J.R. Whalen. Our topic tonight is one that has gripped this country and the New York metropolitan area for the past 20 years, and that is AIDS and the spread of AIDS and HIV and the threat it has on society and efforts to curtail it and prevent it. And talking to us this evening are representatives of the AIDS Center of Queens County. And joining us from left to right on your screen are Valisa Green, Luis Ortega, and Judy Pedraza, joining us from the AIDS Center of Queens County. What kind of precautions can people take to try to prevent the spread of AIDS?
Well, in reference to that, we have, in terms of oral sex, now when it's a female having oral sex performed on her, we have something called dental dam, which is the same thing that the dentists use usually when they're giving a root canal. If you can't get to dental dam...
And you have one here.
Yeah.
All right.
Please pass it around.
Let's step and take a look.
Here comes the goodie box.
We love guests.
It's going to get real interesting now.
That's why we're here. That's why it's cable TV.
Okay, I'll find it for you.
Okay. If you don't have dental dam, okay, Saran wrap works just as well to prevent the transmission of bodily fluids from the vagina to the person's mouth or vice versa.
Okay.
Okay, now this is a dental dam, okay, and it doesn't look very big, but it stretches, and it's latex, okay?
And that is...
It's non-porous, so nothing can be transmitted through it, okay? It's to be used one time.
Is that latex?
Yes, it is.
And how exactly is that used?
It's taken and it's laid over the pelvic area, okay? And then oral sex can begin, because then there's no way of the fluids that are here getting in contact with the person who is having the oral sex.
Okay.
So it creates a barrier between the mouth and the vagina, so that the vaginal fluids don't go into the person's mouth.
I see.
Okay. And the person's whatever's in their mouth will not go into the vagina either.
But it doesn't prevent the sensation associated with oral sex.
Oh, no, it's very thin. It's very, very thin. Okay? Very, very thin.
And that's available at any drugstore?
Actually, generally, I think they would be at probably more specialty drugstores. But as I said, you can use Saran wrap.
Okay.
Okay, and that's a household item, okay, that generally can be kept in the house and not be out of the ordinary for anyone.
And if folks have any questions, they can always come by any of the centers.
They can come by and we even give them out.
Fantastic.
And people, when they first look at it, they feel very uncomfortable and they say, oh, I'm never going to use that. But just with a little education and instruction, people start to feel a lot more comfortable.
Okay.
And I think that, one of the realities and what we try to validate for people is that, it may seem really strange to use, you know what I mean, that it's not the same as just having oral sex without protection. But we also have workshops where we show people how they can still have excitement and pleasure and be safe. So there are techniques that can be used. There are gels that can be used, with the dental dam to help increase sensation.
You mentioned gels, KY jelly versus Vaseline.
Right.
Which is the more effective as far as preventing?
KY jelly.
Okay.
Yeah, don't use Vaseline. And it's actually a really good comment because, for many years, Vaseline was a common household product that was often used for sex. However, Vaseline is oil-based. Okay. And oil breaks down latex, which is what dental dams and condoms are made out of.
So the water in the Vaseline can actually work against the material in the condom or the
oil.
Oh, the oil. Okay.
Yeah, Vaseline, things like Vaseline, baby oil, Crisco, any kind of oil-based product that often people use for extra lubrication are not safe to use on latex condoms. And so there are other products such as, this is something called Rain, and it's a water-based lubricant, or KY jelly.
So KY jelly is actually the brand name, kind of like how Band-Aid is a brand name.
Right.
But the actual, so you walk into a drugstore, let's say, or you walk into your center, and you you could either ask for KY jelly, or you just mentioned before you call it a water-based lubricant?
Yeah, any water-based lubricant can be used. Now, in a regular pharmacy, what you're going to find is KY jelly.
Okay.
It is the most common one. They buy it. It's on the counter, so you just pick it up and pay for it. But they do come in flavors and colors, and usually you can find those more in specialty shops that are located. Many of them down in the West Village, right? Kind of erotic shops. But KY jelly works just as good. Anything that's water-based. And you could ask the pharmacist if you have questions about what is and what isn't.
Okay, we have a lot more props to look at as we become educated throughout the hour here on QPTV. Our phone number is 718-460-9802. We have another caller on the line for our friends from the AIDS Center of Queens County. Renee is joining us on the phone right now. Good evening, Renee.
Hello.
Hi, how you doing?
I'm good. I just wanted to know, can you, get HIV from blood transfusions like we did in the start of the epidemic? Is that still possible?
It really is such a low risk at this point that statistics are barely even kept anymore.
So I guess, as you said before, in theory it's possible, but the awareness in the blood transfusion process, I guess, is so controlled now.
Well, there's two things that have really kept our blood supply safe from HIV. One is that any blood that is donated is screened for HIV. And so obviously if they find HIV in it, it's not used. Or any other STDs, they screen blood for a lot of different viruses. But the other, and prior to donating blood, there's a pretty intense screening process, which became really essential and necessary once HIV came on board. So when you go to donate blood, anyone who's donated blood in the last 15 years knows that they're asking you a lot of questions before they even take your blood. Questions like, have you had any unsafe behaviors? Stuff about your background, history of drug use, where you've traveled in the world.
So in addition to the questionnaire, then the donated blood is tested.
Absolutely.
Okay, so there's really no room for error.
Right. I mean, the questionnaire is used to really screen out people who may be HIV positive, and so often a lot of people their blood isn't even drawn because they don't pass the screening process.
Okay.
If their blood is drawn, then their blood is tested for HIV.
And somebody out there who's concerned about giving blood, is there a threat for those donating blood that they could acquire the illness?
No.
Okay.
They use sterile. Everything is sterile when you go to donate blood.
Okay.
And so a new needle is used for each person donating blood.
All right. Renee, thank you very much.
Okay.
All right. Let's see what else we have in our props here. We saw the KY jelly, and we saw the dental dam. And I'm sure that these are things that folks in our audience have certainly heard about, but maybe have not seen before.
Well, I mean, one of the things that I was going to mention before in terms of oral sex, Belisa gave a great example of how to use a dental dam if you're having oral sex on a female. And I will kind of preface this by saying it really doesn't matter who's involved, man or woman, two men, two women, 3, 4, 5 people of whatever combination, that these things can be used to help prevent the spread of the virus. And so oral sex on a male, you can use an unlubricated latex condom. So these condoms are specifically made for oral sex. There's no lubrication on it, it's dry.
So non-lubricated condoms.
A non-lubricated condom are designed specifically for oral sex.
Okay.
That way, obviously, once the condom is on the penis, the person who is using their mouth doesn't have lubrication in their mouth. It's just a dry condom. So this is a good way of preventing oral sex if you're having oral sex with a man.
Okay.
Or with having anal or vaginal sex, then we'd want to use a lubricated condom.
That's a good question. We talked about vaginal sex, but also a widespread issue is anal sex. Perhaps, correct me if I'm wrong, does that represent the highest risk? The people engaged in anal sex, does that put them most susceptible to the risk?
Anal sex is considered to be a high-risk behavior, unprotected anal sex.
Okay.
for many years, one of the messages that was put out there was practice safe sex no matter what you do. And that is still a message, and it's still accurate. But we do know that the HIV transmission, or the rates that HIV is transmitted, is lower through oral sex than it is for anal sex. So there's still a risk, no matter which way or what sort of sexual behaviors you're engaging in. But anal sex definitely transmits the virus easier if it's unprotected. So definitely for behaviors like vaginal and anal sex, we do support and encourage people to use condoms each and every time that they're going to engage in that behavior.
Okay. Are you open 24 hours a day?
No.
Okay.
You wish.
Generally, we're open from 9 to 9.
Okay.
On Wednesdays, we're open from 9 to 8, and Friday, 9 to 6. That's the Rego Park site. But the other sites have hours very similar.
When, I read something at one point, and it said that before engaging in oral sex, you should not brush your teeth. You should not floss. Is that a myth, or is that... Because the thought was that you could cause a little bit of bleeding in your gums. Is that a valid concern?
Anytime there's a possibility of blood being present is a concern. And so we know that if someone has sensitive gums, gingivitis, that it's quite often, and most of us have brushed at one time or another, and there's a little bit of blood, right? It's not that big of a big deal, but yeah, you want to avoid having any sort of blood being present during any sexual encounter with people, and so you may want to not necessarily, floss.
Okay.
You could brush your teeth.
Right.
So if you know that your teeth or your mouth are particularly sensitive to flossing or brushing, then do it after you have oral sex so that there's no threat whatsoever of there being any blood in your
Right, because then there's a possibility of there being blood in the person's mouth.
And Cynthia is joining us now on the phone. Good evening, Cynthia.
Hi, good evening.
Hi.
How are you?
Very good.
I have a question. I went to one of the city agencies and I took an HIV test. And the counselor was describing HIV-1 and HIV-2. And I'm still not clear what's the difference between HIV-1 and HIV-2. I was forced to test negative. But when I asked for my results, they documented HIV negative 1. And then I proceeded to test negative for HIV-2. And I'm still not clear. The person did say that I was negative, but did not document negative for HIV-1 and negative for HIV-2. I would like to know the difference between both of them.
All right.
Great question. A lot of good questions tonight. There are two main forms of the HIV virus, and they are classified as HIV-1, which is the strain that we see most common in the Western Hemisphere in the United States. There is an HIV-2, which is an HIV virus, but we don't really see, that virus is not common in the United States. HIV-2 is most common in Western Africa. And so in areas, in that area of Africa, you have a lot of people who are infected with HIV-2.
So it's a different strand of the virus. Is that the best way to describe it?
Yeah, it's a different form of the virus. And so in the United States, when you get an HIV test, you're being tested for HIV-1, which is the HIV that is common in this part of the world.
You mentioned Western Africa. That's how it arrived in this country in the early 80s. Is that correct? It somehow came from Western Africa to this continent?
I don't think that anyone really knows how it traveled from continent to continent. I mean, there's a lot of theories. I think that, there's theories that it was made in a laboratory somewhere in this country. I mean, people really have a lot of different ideas as to where HIV came from and how it may have come to the United States. There are theories of how it may have evolved from similar viruses that we see in simians. But I have concerns about necessarily saying it originated in one place, because I think it also causes a lot of stigma, in addition to the normal stigma attached to HIV/AIDS. And we don't really have concrete evidence of any sort to to say that it originated in Western Africa or for any other part of the world for that matter.
Okay. We talked about earlier how in the community you educate children, teenagers as young as 13, and then I'm sure you talk to folks in all age groups, all the way up the spectrum. What do you find about the spread and the education among different ethnic groups, whether it's Latinos, whether it's African Americans, or white or Asian? I'm sure that AIDS doesn't discriminate among any age group or any nationality, but as far as the spread, what's been documented about the spread among different different nationalities?
I can do that one as well, I guess.
Okay.
We have seen. There's a lot of things to consider when you're looking at the trends of HIV, right? Where do we see the HIV epidemic going? We know that in the early 80s we saw high rates of HIV amongst white gay men. Not all gay men, white gay men. And then we identified it amongst intravenous drug users. And I think it's important to note that at the time, I mean, we know now that HIV can affect anyone who's engaging in those behaviors we discussed earlier.
Doesn't matter
really,
what color they are.
Doesn't matter your gender, your color, your race, your ethnicity, your sexual orientation. If you are engaging in a risk behavior, you are susceptible to getting the virus. But in early on, you know, there was a lot of stigma attached to the virus. Only certain people were even being considered to get tested. And so, of course, we saw high rates in those populations. I think one of the unfortunate things that happened early on in the epidemic is because it was placed sort of in certain communities, and other communities felt it wasn't their problem. But it was always their problem. And so today we see high rates amongst people of color, African American and Latinos. We see increasing rates amongst women. And today HIV is actually spread more commonly through heterosexual contact than it is through homosexual contact.
Really?
Well, part of it is, you know, the gay male community really mobilized early on in the epidemic to educate themselves and to begin practicing safe behaviors, while everyone else who was susceptible felt it wasn't their issue. And so throughout most of the 80s, unless you were gay, you didn't think HIV was your problem. But it was. It always was. But those messages were not being put out to the general population in a way that could have stemmed the epidemic. And so people of all backgrounds, sexual orientations, race, ethnicities, genders were becoming infected throughout the 80s, while gay men were beginning to practice safe sex and start taking really care of their health. And so then we start seeing the shift into the 90s and into the new millennium.
We also see now a lot of interest from different church groups, and there's a big push now from faith-based organizations to educate people in their parishes and temples, which is something very new.
That's fantastic. We have another caller on the line. Joining us now tonight is Karen. Good evening, Karen.
Hello.
Hi.
I would like to see if someone there could demonstrate some of the different kind of protections that they have besides dental dam. I have a few young people in my house that I would like for them to see that there's other things besides Trojans and stuff like that.
Great. All right, we'll do that for you right now.
Thank you.
Well, one thing we have is something that may not be known about very well. It's called the female condom. It looks very different from a male condom. This is how it looks. Okay? Now, in order to insert a female condom, this is going to be the vagina. What you do is you take it and you pinch it and you squeeze it all the way back, and this as far as you possibly can. And then there's the pelvic muscle. Oh, one other thing. If you've got long fingernails, you might want to be careful. Okay? This is the pelvic area in the back, and then you pull it, and it will become solid, and it will be in place. It will not slip out, and at the ring, you must always make sure the ring is fully flush against the vagina, so that way you know that it will go, the penis will go directly in, not on the side, and will not squeeze it in because that will defeat the purpose.
Now, the material that's made of, was that also latex?
This is polyurethane. Okay, polyurethane is 40 times stronger than a latex condom.
Wow.
And as with all condoms and dental dam, it's for one use only. You use it, you discard it. We also have, where they go? Okay. Something called a finger cot. Okay? Forgive the nails. The finger cot. Oh, okay. Good. Do this.
It's called a
Finger cot.
A finger cot.
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 Right, and you can see that the finger cot looks like a very tiny condom for the most part.
Yeah.
It's made out of latex, and it is to be placed over the. Quite often, if women are getting their nails done, or your cuticles, the edge around the nail bleeds sometimes, or people who use their hands in their jobs and they're constantly getting nicks and cuts on their fingers. This is one way of protecting the finger, or not only from having body fluids get into any cuts on your finger, but if your finger is bleeding for whatever reason. And so you would put it on the finger much like you would put a condom on a penis. You just roll it right over the finger, and so any sort of openings on the finger are not exposed to body fluids.
Okay.
And these things, I think, people have become very creative post-HIV. You know what I mean? That when two people are trying to excite each other, be intimate one another, and give each other pleasure, that it's not only about a penis and a vagina, it's about the hands and about your tongue and about a lot of other body parts. And so things have been developed and created so that people could continue to use their fingers and hands and other things and still be safe.
Okay.
And the finger cot is one of those examples.
And Belisa has another prop there.
And this is the standard latex condom for males. Okay? When you're using the condom, you make sure you pinch the tip. After you take it out, you okay. Oh, you hold it. Okay. Slide it down. Oh, I'm sorry. Let me do that right. Okay. Now. Okay. You pinch the tip. You put it on and you just slide it down. Okay? But you always make sure that you pinch the tip, specifically so that the air is removed. Because if you don't pinch the tip and the air is not removed, it can possibly explode after ejaculation. And in order to remove it, what we do is we slide it up to the front, pinch it off around the head, twist, pull it off, and then you knot it so that the fluids, okay, do not come out and does not get on either person. Okay? And then you can discard it.
One use only.
One use only, always.
Yeah, and I'll just add, I don't know if you can see this good on TV, but these things do come extremely lubricated. So, like, I know your hands are all shiny at this point.
They're shiny and
Oh, we can get you a napkin.
Thank you.
So these things do come lubricated so that there's less friction between the two partners. Friction can cause the condoms to break. And so we want to reduce that. So the condoms do come lubricated. If you need extra lubrication, you can use water-based lubricants.
Except on the female condoms. The female condoms must have silicone lubrication.
Okay.
I wanted to add something about the condoms. You have to be sure to check the date.
Oh, good
Because
idea.
they do have an
There's an
expiration
expiration date.
date.
The expiration date you can generally find right on the back. Okay? Generally they will print it so you can actually see it, but sometimes you can't, but you always need to look. And if you're in doubt, you can always just kind of pinch it. There should be some air still inside of it so that you know that it's fresh and it's usable.
So
but always check the date.
If a condom is not fresh, let's say the expiration date is January 04, and let's say it's October 03, and now we're in February 04. Would the material start to break down the actual surface of the condom?
Yes.
Okay.
Yeah, I mean, the closer to the expiration date, the higher likelihood that latex is that the condom is going to break.
Okay.
Latex isn't, doesn't last forever. And like food and like a lot of things that have expiration dates on them, the expirations are there to signal or to advise the consumer of when it's good to use and when it's not good to use. And if you have an expired condom, you need to discard it and get one that isn't expired. And that's, I think, important. I know And I think maybe still today, but back in the days, a lot of men carried condoms in their wallets. You know what I mean?
Yeah.
And by the time they got to use it, or adolescents, in the hope of using it one day, the condom expired. In the year they had it in their wallet, and then the condoms break and they're really ineffective.
Does the female condom have an expiration date also?
Yes, 5 years after the date of manufacture.
What's the range of dates for the male condom?
The range of dates for the male condom is about
I
7 years.
I think it's 7 years from the time that they're manufactured.
Oh, okay.
Yeah, so they do have, they do have a long life, a long shelf life. And I would say if you have a condom that has an expiration date, at this point, if any expiration date prior to before 2005, since we're in 2004 now, that condom's been around for a couple of years already. So you either have no use for it, or you should just go and get a fresh batch. You know what I mean? They're inexpensive. You can come to ACQC. We give them out for free. We're more than happy to do that. And the condoms are usually have an expiration date of at least 4 years. The condoms we're distributing now expire in 2007.
About 2 minutes left. We have one more phone call. Mary's on the phone for us tonight. Good evening, Mary.
Good evening.
Hi.
And I just want to say that I think this is a great subject, and it's a very important one. And I was wondering how one could volunteer.
Wow, that's the question of the night. How can folks take part?
We're always looking for volunteers, and all they have to do is call, and we'll have them come in and have a little interview and see what they might be interested in doing.
What's the phone number?
It's 718-896-2500.
Okay, 896-2500, 718 area code. Of course, you can go to their website, acqc.org, and they'll get you all set, because I'm sure that, knowledge is power, but the more bodies you have spreading that knowledge is worth its weight in gold.
Yeah, and I'll just, I'm excited that we even had one person call asking about volunteering. We are dealing with an epidemic. It's an extreme public health issue that concerns all of us. And that we are always looking for people to help us out. In our department, I'm the director of education, and we use a lot of volunteer paraeducators, people from the community who are concerned about their community, their daughters, their partners, their friends. They get training with us, and they go back out into the community to talk to people about HIV/AIDS and how they can protect themselves. So we're always looking for people to help us in the fight against HIV. Absolutely.
Give them a call, 718-896-2500. I want to say thank you very much to Belisa Green, along with Luis Ortega, Judy Pedraza from the AIDS Center of Queens County, here on QPTV. I'm J.R. Whalen. Thanks for joining us here on Talking About. Have a good night.